Hello guys, welcome to my channel. Today I'm going to discuss a very important topic, that is diagnosis of poisoning in living and in dead. Firstly, we have two scenarios. One is in living and in dead. In living, we'll ask for the history, and we'll see the signs and symptoms, and we'll go for the investigations like breath, blood, urine, and stomach wash contents. We'll just do investigation of the blood. We'll take blood samples, we'll take urine samples, and we do as to gastric lavage, like to know the contents of the stomach, like what he has taken. So we go for the stomach wash contents. And in dead, we'll ask the history and circumstantial evidence of the crime. And postmortem examination, we'll do both external and internal postmortem examination. And we'll go for the chemical analysis. In the chemical analysis, for the FSL, forensic science laboratory, and histopathological examination. And now we'll discuss in living. Firstly, diagnosis of poisoning in living. History of ingestion of poisons, drugs, food, or alcohol, etc. History of depression or any other psychiatric disorders. History of group of people suffering from similar symptoms at the same time after ingesting food or drinks from a common source. For example, we have hostels, and we have restaurants where they cook at the same place, and if have any lizard or any poison added unknowingly, so all the people have the same symptoms. So by this we come to know it's because of the same source. If the people all taken the food from the common place have same symptoms, so yeah, we have to know, like we have to ask whether many people are suffering with the same symptoms, so that we can know what is the common source of the, like from where they got that poison, from where they got poison and all. And we can examine the food, or like drinks, and we can like know what poison they consumed, and we can go for the treatment by like testing all the food what they have taken and all. Next, previous history of suicidal attempts by consuming drugs or pesticides. We have to ask whether the person has attempted any, like previously had any attempt, like attempted for taking by taking any poisons and all. We have to know about the history. And occupational history. By this, occupational history, farmers and workers in a factory manufacturing hazardous chemicals, because they unknowingly get exposed to that chemical. Like farmer, they spray pesticides, and while they're spraying, they don't use, they're not I mean, like they're not educated, so they like inhale while they're spraying. They don't use mask, they don't use the what mm, what is this, gloves. So they get exposed unknowingly, not knowingly but unknowingly. Even my father is a farmer, and once he had a poisoning, unknowingly got inhaled all the poison. Yeah, he's okay now, but yeah. Next, signs and symptoms. Onset of signs and symptoms are sudden in nature. Signs and symptoms include, we have to ask all the signs and symptoms related to all the systems like GIT, CNS, CVS, respiratory system, urinary system, skin, eyes, and chronic poisoning. And GIT, normally what we ask for the like nausea, vomiting, diarrhea, pain abdomen, burning sensation in the mouth and and upper GIT, gastrointestinal tract. And CNS, we ask for giddiness, confusion, delirium, anxiety, convulsions, paralysis, unconsciousness, and coma. And CVS, we ask for the palpitation, cyanosis, petechial hemorrhages, and syncope, etc. Respiratory system, we ask for sneezing, coughing, wheezing, dyspnea, and cyanosis. Urinary system, oliguria, dysuria, anuria, hematuria, proteinuria. Yeah, we should ask like whether he's having a difficulty in urination, or whether having any blood in the urine, or like he's having like having the mutilation frequently, or is not, or how much amount is urinating. We have to ask. And skin, we have to check for the bite marks for snake and scorpion. Like we don't know which the, we can like make out whether it is a snake bite or scorpion. And injection marks in drug addicts, jaundice, sweating, increase or decrease in temperature. It's like in jaundice, our skin becomes yellow, so that by that we can make out there is an issue of the liver. There is some poison which has affected the liver and all liver function. And eyes, we check for jaundice, congestion, like in eyes, which in the eyes you have to check for jaundice and congestion of the eyes, or dilated or constricted pupil. We have to check it by like using a torchlight, sending the light rays into the eye. Chronic poisoning, weight loss, anorexia, sunken eyes, raindrop appearance on the skin, like in raindrop appearance, we have like pigmented skin and light skin, pigmented skin and light skin on this on the like what on the skin. So raindrop appearance in skin, magnon symptoms, jaundice, tremors, insomnia, irritability, injection marks, and phlebitis and sexual transmitted diseases, etc. Next, investigations, we already know we do breath, blood, urine, and stomach. So in the breath, by using a alcometer. Next, in the blood, to know the presence and the concentration of drug, like alcohol and the poison in the blood. We'll take a blood sample and we investigate the present, like the concentration of the drug, or what drug is present, or what is the amount of alcohol which is present. And urine, we collect the urine sample and we check for the presence of any concentration of the drug or alcohol and poison in the urine. And stomach wash contents, we will do gastric lavage and check for presence of any poison or capsule or tablets of poison, etc. And this is what for the living. So it's very easy, guys. And next we'll go for the dead. So diagnosis of poisons in dead, as we don't have a person to speak, so we have to speak with all the neighbors or the people who stay nearby and his friends, his family, etc., to get the information, to get the reliable information. So we have to speak with the people nearby. So history of, and we have to see the scenario, like how is the case scenario, how is the crime scene. If the person is dead, we have to like how is the person is lying, what is there any drugs nearby, what is the position he is, like is there any stains on the skin. So we have to ask the history or the circumstantial evidence of the crime. Information is gathered from the relatives, friends, or co-workers and neighbors, and read the medical records if available. Like from that we can know, like if you have any what any depression or psychiatric issues. So if he is having any like any issues, physical or mental issues, so that if you have accessible to medical records, we have to go for it and we have to read it and read the inquest report in detail. And postmortem examination, so in postmortem examination we have to do both external and internal. Firstly, for the external, we will look for the clothes stains of the poison and vomit, because while he's taking the poison, there are some, like there are chances that a poison may fall on his clothes. So we can get the stains. From the stain itself we can know what poison is it. From the vomit, while he's vomiting, there some might be some stains that happen on the skin, on his dresses. So by that we can know by the vomit and the stains of poisons. And colors of postmortem lividity, it's like postmortem lividity is color change which we can see on in the body after in the dead person. This mainly occurs because of the accumulation of the blood in the what in the vessel, because of the gravity. So this may be, if at all the person consumes carbon monoxide, the postmortem lividity is cherry red in color and dark brown and phosphorus. And characteristic smell of poison, if at all it is fruity, if at all if the, we'll get a body, if at all you'll get a fruity smell, then you can like we'll know with this with experience, because we have to, like we are students, we are learning, but all our professor and all, they might be used to, like by the smell they can guess what poison he has taken and all. So fruity, it might be like chloroform and nitrites. And garlicky smell, phosphorus, arsenic and parathion, rhodonic, hydrogen sulfide, fishy, zinc phos. We have to by heart this. And mouth smell of the poison, like we'll get smell from that we can make out. And if you have to see whether the mucosa of the mouth is in inflammation in the mucosa of the mouth, or corrosion. The color changes in the corroded mucosa membrane, if at all the mucosa is corroded, like what color it is. For example, if you see it is black color, then the person might have taken sulfuric acid or hydrochloric acid, because it's the strongest poison. So they'll burn everything out. So all the mucosa becomes black and gray, brown, and like if all the mucosa is brown, it is nitric acid. Grayish white, carbolic acid, and caustic alkalis. Bluish white, magnesium chloride. Orange, potassium chromate. Respiratory tract edema and congestion of glottis and trachea. We have to see if there is any edema or congestion of the glottis and trachea. The stomach, I will do gastric lavage, and we have to see for any smell of the poison. And like immediately if we cut the stomach, we'll get some peculiar smell. By that we can make out what poison it is, what poison it is. Next, contents, like what are there in it. Like no, sorry, we don't do gastric lavage in the dead. Sorry. Uh, like we will do postpartum, no, then we'll cut the stomach, then we'll come to know contents like tablets, seeds, leaves, poisons, along with food materials. And mucous membrane irritation, hyperemia. We have to see whether mucous membrane is like irritation in it. Like if it irritation, if there is any irritation, the mucous membrane becomes so red in color. And hyperemia, ulcers, Also, mainly the ulcers are seen along the lesser curvature due to liquid what is this, due to liquid corrosive perforation hemorrhages. See, as we have the stomach like this. Sorry, I'm bad at drawing, but yeah, I'll try. Very yeah. So this is the greater curvature and this is the lesser curvature. Whenever we take food, most of the like food goes like this, so we can see ulcers mainly in the lesser curvature. Should I draw it? Next, intestines like hemorrhages, irritation, and ulcer, liver. We have to see for necrosis and cirrhosis. Heart, we have to see for viper, bite, arsenic, antimony, phosphorus. Causes all these causes subendocardial hemorrhages. Sorry, all these viper, bite, arsenic, antimony, and phosphorus causes subendocardial hemorrhages. Kidney cause necrosis seen because of the carbolic acid and cresol. So there are few laws which are related to these poisons. For example, Section 201 IPC, like doctor should preserve evidences in case of suspected poisoning, like urine, blood, vomits, etc. If at all we find any like any poison in the urine or any blood in the vomits, we have to preserve it. That speaks about Section 20 I 2 sorry 201 IPC. See, like remember it like this, like at 20 years of age, our first aim, like our first motive is to preserve money, because we are dependent on parents, so we should not always ask, should not be like dependent on them, no. So we have to, first thing is we have to like preserve, save money, we should not spend it too much. So it's like 201, I just remember it like that, 201 at age of 20, our first aim is this. Doctor 201 IPC, doctor should preserve evidence in case of suspected poisoning. Next to Section 39 CRPC. See, there are three people. They killed nine people, and this speaks about doctor should inform the legal authorities in case of homicidal poisoning. If at all you are a government doctor and you got a poison case and the person has died, and you came to know that it is a homicide, someone has killed him, someone has poisoned him, so you have to inform the higher authorities. And if you also have to inform, if even if it is suicidal case. But if you are a private doctor, you have to inform the homicidal cases, but you should not inform the suicidal case. Like there is no mandate that you have to inform the suicidal cases, but you have to inform all the homicidal cases, whatever comes to your hospital, comes to your clinic. So Section 39 CRPC. So whatever happens in your class, the CR have to take it, CR have to inform the teachers. And also I just remembered it like this, like 39 CRPC, doctor should inform the legal authorities in case of homicidal poisoning. A government doctor must inform all cases of poisoning, both homicidal and suicide, to the police. And a private doctor should not need not should not but need not inform the police about the case of suicidal poisoning, but you have to inform about the homicidal poisoning. For causing death, injury, or administration of poison, a person is tried under Section 299, actually 304A, 324, and 326 IPC. Actually, I live like, okay, yeah. If you want, you can remember all this, but these two are mandatory. You just have to remember this. Yeah, this is what, guys. Thank you so much for listening. I hope you like this video.